People of St. Martin, today, March 20th, I come to you once again as Prime Minister and Chair of the EOC to update you on the latest developments regarding COVID-19 developments on St. Martin. I will be bringing to you an overview in a couple of aspects, the first being the social affairs aspect. I would like to take this time to inform the general public that a social stimulus plan is being finalized for persons who will be directly affected by the economic downturn as a result of the COVID-19 developments. We are in constant contact with our kingdom counterparts, the Netherlands, Aruba, Curacao, and Bonaire, who together during a video conference held yesterday, March 19, 2020, confirmed our commitment to work together to alleviate the challenges that have already started to rise as a result of COVID-19 virus, which is a national health emergency of international concern. Our Dutch Kingdom partner, in the person of Minister BZK Knops, assured us that he would highlight the needs of the Caribbean islands in today's Kingdom Council of Ministers meeting, which was already held in the Netherlands. We, the islands of the Caribbean, have highlighted to Minister Knops our immediate as well as projected needs for the rest of this year, 2020. Minister Knops has assured all three countries that some form of assistance, which will be formalized during the coming week in bilateral discussions, will come forth. St. Martin has already expressed in this quadripartite meeting between the four countries of the kingdom that its financial needs of assistance have an immediate effect. As you know, we have already been working within a deficit budget as a result of Hurricanes Irma, and our liquidity support has been attached to conditions, though we have been able to reduce them, are still not finalized. The Minister recognizes this, and we will be talking upon this topic during the coming week. As a basis for the social stimulus plan, a social assessment report will be conducted by ESF 7 and the Ministry of VSA to determine the impact from a social perspective. ESF 7 has already identified in the OC that the approximately 1,500 persons currently receiving social welfare will continue to do so, and plans are already underway to deliver care packages to them within short, should the need arise before the end of the month. They are in constant contact with their clients and are making plans for the expected increase in persons requiring social assistance. The next aspect I will address is healthcare. The St. Martin Medical Center is currently expanding its capacity to be able to offer triage for COVID-19 patients at the emergency room, as well as working on the finalization of the pavilions together with government, which the steering committee has approved the use of $2.5 million via the NRPB Trust Fund, which will outfit this pavilion. The pavilion will then contain 6 rooms, of which 5 quarantine rooms holding 2 persons each, therefore equipping it with 10 beds for quarantine purposes, and the last space being a workspace for medical personnel. This effort has been ongoing for some weeks, and I am very happy to announce that the specifications of the quarantine rooms have been approved and therefore ordered, and now the payment can be guaranteed. We expect that they should be here shortly, while the pavilion is being constructed on the location where the parking lot was approved for medical center on the Raoul Illich Sports Complex, former, let's call it basketball, netball court. Also, other containers are being used by St. Martin Medical Center to expand their capabilities for immediate care for COVID-related patients. But I must reiterate, as of today, there is still but one COVID-positive patient, and I must update that the second confirming test has also come out positive. However, the spouse of COVID patient 1 has tested negative. Contact tracing of persons returning to St. Martin or suspected of being exposed to the virus has been heightened by CPS, which falls under ESF 6. 13 persons are currently being monitored as a result of both COVID case 1 as well as a positive COVID case from the French side. These persons will continue to be monitored according to CPS's approved protocol, which I will explain a bit further. Persons who have been identified as having traveled from countries with COVID-19 clusters are required to fill out a form that is being provided to those arriving today by the immigration officers or public health officials currently stationed at the airport. These forms include a letter which is signed by me and a document explaining the process that they should follow once they have been isolated at home. They are also being informed that they are required to be in isolation for the next 14 days. It has been brought to my attention that more than one plane landed today, and therefore not all arriving residents have received this information. The information is also uploaded on our Facebook page, and all who have traveled home in the past week, that is from March 13th to today, are required to download these documents and read. If you have traveled home, please contact CPS at number 914 during working hours to make an appointment to receive the letter as well as fill out and sign the forms that are necessary. The letter reads as follows. Dear traveler, you received this letter because you have returned from a country or region where there is a local transmission of COVID-19. To help stop the spread of the virus, you are required to remain at home for 2 weeks. The period you have to stay at home is from the start date through 14 days later, the ending date will be noted. So each person's form will note the start and end date. We realize that this can be challenging and can have consequences for your everyday life. However, it is very important to follow this advice and the attached guidelines to protect your family and others around you from becoming ill. What does this mean? 1. You must stay at home during the period of 2 weeks, except if you have to get urgent medical care or on the advice of the physician or healthcare worker. 2. Do not go to work. Do not go to school or visit public areas. Do not use public transportation, taxi, or share transportation with others. If you had a previous medical appointment, call to reschedule. Restrict activities outside your home. You may be in your garden or on your balcony, only if there is no other person present. Ensure good personal hygiene and good hygiene within your home. Follow the guidelines in the attached brochure, Coronavirus Prevention Steps Home Care, which I mentioned is available online for all to see. If you do not follow the instructions, additional legal measures might be taken to ensure your stay in isolation to protect the health of others and yourself. If you or anyone in your household suddenly becomes very ill, please contact your physician by telephone first for instructions. Do not visit your doctor's clinic or the hospital without prior contact by phone. Should you have any questions, please contact your healthcare worker at the Collective Prevention Services via phone number 914 or your physician, your family doctor. This is signed by me, Silveria Jacobs, Prime Minister of St. Martin. I once again request to all residents who have gotten the opportunity to return home during the past week, that is from March 13th to March 20th today, and have not received said letter which I have just read, please call CPS at 914 to arrange to receive such. Also, download the Coronavirus Prevention Home Care Steps document that is now registered on government's website as well as Facebook page. The attachments also have the consent form which you have to sign and which you will receive a copy of for your person to understand your responsibility in ensuring that the coronavirus is not spread throughout our island. We are quite blessed to only have one case thus far, seeing the pandemic that has spread across the world. And we as government are taking all necessary steps. We may not have all of the militaries that other countries have, but should our population not find it prudent to adhere to the request being made by me as Prime Minister and Chair of EOC, being made by the health professionals, being made by the business community, being made by all institutions who are now open to receive guests, who are still open to receive the public for necessary services, essential services, which we have allowed to remain open. If we continue to disrespect the law of the land in terms of harm no other if you know better, I believe that we will then have to move to much stricter lockdown methods, which I think will have a negative effect on many more people than is necessary right now. So, I am asking all passengers who have come in as of today, I'm repeating this afternoon, this morning, or any time from March 13th to now, to please fill out the forms, hand them to the immigration or healthcare workers, call 914 if you're already landed and have arrived home. If you are currently on the streets of St. Martin, I admonish you to return to your home post-haste. You should not be out in public. I have received complaints, and that is why I'm so very annoyed at the moment at persons not following the recommendations. Yes, they are recommendations, but I would like to believe that natural human behavior and understanding of the situation would push us to do the right thing. The civil registry and the receiver's office have been open throughout this process. Social services were closed yesterday. Upon my request, they have been reopened to ensure that the public can get the necessary services that you deserve. However, if you are blatantly coming off of the airplane and coming to the government building, then you are forcing us to move to even more stringent measures. This is not responsible behavior. This is not community. I expect the general public to adhere to the recommendations I make because these are not being made to inconvenience you. They are being made so that we can remain safe. If by any chance any one of our returning residents is sick, then the isolation that you do in your home will contain the virus to your home and not spread all over the world. There is a beautiful video that I have seen on social media. It is from the Netherlands, and I'm having it done in St. Martin so that it reflects to us as well, because it's in Dutch and we won't all understand it. However, it clearly shows how one person can infect a whole great group of people. And St. Martin is a small place. If you have been in these areas and have possibly contracted the virus, even though you are not showing symptoms at the moment, you will then go to church, spread it to your church members. You will go and visit your friends at their homes, spread it there. You will go to the basketball court in your community, spread it there. You will then, I think you get the point I'm trying to make. I am also, through this address, trying to address social distancing, which is also part of the address, and I will get to shortly. I would like to update that the shipment of PPEs, personal protective equipment, which was promised by the Netherlands, has arrived. Masks, gloves, as well as covering for especially our medical personnel on the front lines. This arrived in Bonaire and has arrived on St. Martin as of today. These PPEs are intended not just for St. Martin, but also for Saba and for St. Eustatius. I must reiterate here that not only are we cooperating as the 3 countries within the Caribbean, we are also facilitating that the best islands get what they deserve as Dutch entities as well. I now update you on our business affairs. ESF 10 is conducting an assessment to determine how our, let's say, partial shutdown is being effectuated, how it is working out, and whether we need to take further measures. We are monitoring the frequency of movement as well as the compliancy in terms of social distancing at supermarkets and throughout other public areas. A regulation for social distancing is being prepared as we speak, which will address persons making use of public transportation, being in business and public areas, and this will be implemented within short and published for all to see, know, and understand. Let me be very clear and transparent. We are currently unaware when this crisis will be over, especially globally. However, we plan and hope that within 2 weeks, the worst would have been over, would have subsided to the point where we can relax our measures. However, that remains to be seen. In the meantime, we as a country, a very small 16 square mile country, sharing a border with French St. Martin with all those challenges, we are trying to have some form of normalcy and still ensure the safety and security of our population. If, for whatever reason, the recommended social distancing, as I mentioned before, is not being adhered to, the EOC will hold an emergency meeting to decide how we will upscale the measures, which will then lead to a total shutdown and minimal mobility for the population for the entire 2 weeks that is left. Social distancing, as we have defined, that is recommended in all public areas where services are still being carried out, is that you should be at least 1 meter and if possible 2 away from other persons. That means if you come to the civil registry or the government building and inside it is properly regulated how far you should stand from persons, while you are waiting outside to enter, maintain a distance of 1 meter. I also noticed this at various banks this morning. Lines on the outside with people right up under each other. People of St. Martin, this is not just for my safety. This is for your safety and the safety of your children and people. When you are in such close contact with others, you are then going home where your children are at home and therefore bringing the contaminants into your house. Follow the recommendations of your government. Maintain 1 meter at least distance between you and other persons. Our inspectorate is going around. We are checking. And if it is ascertained that you as a business are also not promoting the proper distancing, then you will also be shut down. Businesses allowed to be operational according to our list of essential business will now be mandated as of tomorrow, Saturday, March 21st, to close at 8 p.m. Let me repeat that. Mandated business closures will now be as of tomorrow, Saturday, March 21st. All businesses will be mandated to close at 8 p.m. This again in order to minimize movement and limit the spread of COVID-19. To update you on public order and government services. Public order is being maintained and monitored by ESF 5. Chief John has updated that there has been no unnecessary skirmishes, and in fact, they will continue to do even more patrols to ensure that the minimized movement is upheld. Essential government services such as labor, as I mentioned before, social receivers, and the civil registry will also in the coming days be provided with a hotline number to be accessible for emergency cases as well as to schedule appointments. It is recommended, as a matter of fact, that if you do not have an urgent case at any one of these government offices, that you call and make an appointment to have minimal contact with our civil servants. If the proper protocols which we have put in place to protect our civil servants are not adhered to, all public services will then be moved to an appointment-only service to avoid such possible contact. A communique with the changes in hours of operations from our government administration and other ways on how to access government services will be communicated in my next press conference. Until then, the services will continue, as I mentioned before, but with reduced times and opportunity. Along the lines of many businesses in St. Martin, government is also now promoting and recommending that all of our business essential services that are allowed to be open will designate the first hour of business to senior citizens as well as vulnerable persons such as pregnant women and persons with children. This is in order to minimize contact, so therefore the general public is asked to make use of these services from 1 hour after starting time. That is at banks, that is at GEBE, TELEM, UTS, Government Administration Building, and all other services. When utilizing restaurants, we recommend that you also call ahead to order whatever it is, food you would like to have, so that there is not a bundle of people waiting in the restaurant on food. If we notice that this becomes a problem, then that too will be limited and you will be required to cook all your own food. We do not want to have to go there with the current situation. We believe that we are keeping the virus properly contained, but we are relying on you, the people of St. Martin, each and every one of us, to do what we have to do. Each and every business and service and institution which has been granted the opportunity to be open to maintain the highest level of hygiene for themselves, their clients, as well as their staff, and to ensure that social distancing is being practiced in and around the establishment. I hope to have properly informed everyone about the steps government is taking. Realize that we need you and you are part of the solution as well as part of the problem. I look forward to hearing continued good news from my ESFs. I thank each and every ESF coordinator for the contribution they are making to the EOC. I also thank all the ministers in my cabinet as well as members of parliament who have continually given great suggestions to improve upon regulations that have been put in place already. Today, March 20th, we are yet with one case. We pray to God that this continues and that each and every one does our part to ensure that. God bless St. Martin. Be safe.